Welcome to your ear stimulation session. I'm Dave Maybee, Director of the Canadian Institute of Auricular Medicine, and in this video I'm going to show you how to stimulate your own ear to help with your chronic low back pain. Let's get into it. What we're going to do before we start is record our pain on a 1 to 10 pain scale. Now, it doesn't matter what other people's pain is like, it matters just what yours is like. And that is what we're interested in because that's what we're going to compare it to at the end. So I want you to mark down what your pain is right now out of 10. And then once we're finished stimulating our ears together, then you can mark down what your pain level is at the end of the session. Okay, so mark it down and let's start. First, we're going to be looking for the thalamus point. The thalamus point is deeper in the ear, and this bump here is called the antitragus. And so if you find the antitragus and you go down into the concha of the ear, then you find at the bottom of this antitragus the point of the thalamus. And I'm going to just I'm just going to move my golf tee around a little bit and poke around down on this angle until I find something tender. And I'm not pressing that hard because an active point, remember, is going to be quite tender even with just a little bit of pressure. There it is. Now that I found it, I'm going to move very gently without sliding on the skin in circles. I'm moving the tip of the golf tee in little circles, and I'm feeling quite good pain there. And I'm going to do this for 20 or 30 seconds, and you can do it longer if you like. Now, the thalamus is very important because it's the gateway for all sensory information. So not just pain, but anything that we can sense. Numbness or irritation, restless leg, anything that we have a feeling of. The thalamus is the gateway of that in our brain. It actually manages the way that our brain interprets pain. And if it feels like it's too much pain, you can lighten up your pressure a little bit. You can change directions if you like. You can go clockwise, you can go counterclockwise. A little bit of both. There. That's the thalamus point, stimulated. Okay, now we're going to stimulate the laterality point. Now the laterality point is right on the cheek, so it's a little easier to see in the video. And for me, because I have a beard line, it's easier to find. It's right before the beard line starts. Okay, so, and remember, I'm right in line with the middle of the tragus. Okay. And then I come right out from the middle of the tragus to about here. Okay, so I'm going to take my golf tee and I'm going to find an area, poke around a little bit and see if I can find something. Okay, so I found something here that is quite tender. And so I'm just going to stimulate it, little circles. Again, not sliding on the skin. Isn't it cool how each one of these points is like a button that we're pressing that sends a signal to our brains that actually calms down the pain signals? It's pretty amazing, really. And we have this tool available to us anytime. So I'm going to do this for another 20 seconds or so. Okay. That's good. Oh, that's a good one. Now what we're going to do is we're going to look for points along the spinal cord. And this is something that you'll want to do on the left and the right ears. Search in this area and look for tender spots. And one really good way to do this is to hold the back of your ear like this with one hand and then poke with the other. And then this way you can actually have some pressure by resisting the pressure with your hand holding the back of the ear. And then you can get a better point. Okay, so here's a really good one that I found. And I'm going to start in little circles. If you're interested in more information about how this actually works from a neurological perspective, we would be glad to direct you to a course that we've created that shows exactly how to use this in a context of psychology. And it's really fascinating that this medicine can be so linked, so directly linked and so useful in that context. Not just for pain, but for emotional health, for mental health. Oh yeah, this is a very, very good one. So you see I'm going in circles, but I'm not sliding on the skin. How's that feel for you? Does it feel painful, but not too painful, right? Okay, we're almost done this one. And like I said before, you can go a little longer if you feel like you want to. Don't overdo it, because you don't want to irritate the skin on your ear. Okay, that point's done for me. Oh, it stays a little sore afterwards, but that's okay. So you can give it a bit of a rub. Oh, that's good. How's your back feeling? So one thing that you can do is kind of move around a little bit and just check out how your back feels after a couple points. If it's going to help you, it should help you almost immediately or within minutes of actually stimulating these points. The next point that I want to show you is the interferon point. Now I am right-handed, and so I'm going to do the interferon point on my left ear. The interferon point is right in this notch right here. So it's actually pretty easy to find, and actually this is one that you can see in the mirror. Okay, there it is, right in the notch there. So this one actually stings quite a bit for me, and so I'm not going to move in circles with this one. I'm just going to stay still, and that is creating a good amount of pain that I want. That is creating the perfect amount of tenderness for me. And we're just going to hold this for another 10 seconds or so. Make sure that you're pressing enough that you get a tenderness, but not too much that it's actually causing some real suffering. You don't want to do that. Just the right amount. And only you will be able to know what that right amount is, because you're feeling it. Okay. Oh, that's good. That was the interferon point. Are you feeling the points? Are they quite tender? And let's check in with our back. So if we move around a little bit, how does the back feel? See if there's any change in the pain. See if there is a little bit more looseness in the back. Just check in and move around a little bit. Okay, the last point I'm going to show that we'll look for is the vioxx point. And the vioxx point is on the back of the ear. But first, we find this line, and we come all the way down to about here. And then we go behind the ear and a little bit down. So my vioxx point is going to be right about here. See? So here's the line. Here's the end of the line on the way down, and that's quite tender too. That's the jaw point, actually. My jaw must be very tight, but we'll get that later. Right now we're after the vioxx point. Directly behind that and a little bit down on the lobe, and there is the vioxx point right there. And you don't have to worry about seeing it because you'll be able to feel it. And that's how we're going to be accurate, is through feeling the tender spot. And that is one of the wonderful things about finding an active point, is that you don't have to guess if you're on the right spot or not. If you're on the right spot and it is active, it will be sore. It will be tender. If it's not, then perhaps that point is not active for you at this time. And it doesn't mean that tomorrow it won't be. Tomorrow, the vioxx point could be one of the main points for you. So, check it again tomorrow if it's not active today. Now, the vioxx point is named after a drug that was very effective at eliminating pain signals in the brain, but it was taken off the market because it was quite toxic. And so this point is named vioxx because it has a similar effect on the brain, however, clearly without the toxic effect. Okay, 10 more seconds with this one, and then we'll let it go. But if you feel like stimulating it a little bit longer, you can. Okay, that's good for me though. Whew, that's a good one. These are all good ones. I want you to think about that pain scale 1 to 10, just like we did before, and mark down what your pain level is now and see if there's even a little bit of a difference. Comment in the comment section below about what your pain level was at the beginning and is now at the end. How easy was it for you to find these points? I want to hear from you about your experience with this ear stimulation session. And don't forget to subscribe to our channel and join me for another ear stimulation session tomorrow as you take a moment to give back to yourself. You deserve it.